My name is Sanjay Sinha. I'm the Executive Director and co-founder of the International Alliance for the Prevention of AIDS.
My name is Eric Ham. I'm the co-founder and current financial director of IAPA.
So the International Alliance for the Prevention of AIDS, or IAPA as we call it, is initially a student-run organization that we developed in college.
It's a nonprofit organization based in southern India, in the city of Chennai, that focuses on HIV prevention, education, and also on HIV services for HIV positive people. This
is done through many different programs, but most importantly, it's done through the passion and the work of the students that we engage. In 2004, I was a volunteer in a similar program that did work in Tanzania. And at the end of the program, I made friends with Eric Ham, and I went up to him and I said, Eric, this is a fantastic idea. Can we reproduce this in India? And would you want to do it with me?
And it just struck a chord with me, and I realized that if we had the time and we had the passion, then there's no reason that we shouldn't be able to do something in India.
And he said, this is what we want to do for the rest of our lives, let's do it.
We went back to the US, finished college, convinced 14 students to come with us to India that summer, and started our first volunteer program.
The amazing thing was at that time, we were so, and we continue to be so passionate about what we're doing, that once you get the idea on the ground and you find the right people, amazing things started happening right after that.
And from there, it's just been continuing to build the organization, continue to hire staff in India, and continue to meet wonderful people here in Phoenix who have been supporting us. In India, the stigma of HIV is still very strong.
Previous to our arrival, there wasn't a lot being done with HIV and AIDS education with students. It was actually shocking that every place we went, they would say, oh, and we don't want to talk about this with our students, we don't think this is real. While on the other hand, when you're speaking with the NGOs, they're saying this is real, the students are being affected by this, but nobody wants to talk about it.
We know that orphanages that we work with have been kicked out of neighborhoods because the neighbors don't want HIV positive people in the neighborhood.
So once we found that what we were doing actually had a purpose and there was an actual need for it, we couldn't stop.
What we like to do is to say, this is not the scourge that you have been told, that this is something that we can work with, that we can prevent, and you can live a productive, healthy life just like anyone else in the world. And I think it's giving people that knowledge to help themselves and to help each other, which is the most important part of our work.
Eric is probably one of the most amazing people I've ever met.
Sanjay is one of the most wonderful people I've ever met.
You can't find somebody more dependable. You can't find somebody that has a better sense of humor while at the same time will get things done.
His energy and his drive is amazing, and it's been a wonderful opportunity to work with him.
When we first started working together, we both realized that there were things he was very good at and things that I was very good at. And luckily, they complemented each other very well.
I think Sanjay espouses the ideal that we set up for the organization, to be giving, to be forward-thinking, and to overall be passionate and compassionate for the work that we do.
I'd say right now, he's about as close to a brother as I'll ever have.
I feel lucky to be able to count him as one of my closest friends. Our programs are very exciting because they do a wide variety of things. We have community education programs where we work with the local people and provide the prevention education so that they can stop the disease from spreading.
Barokia is a project that we started that focuses on the nutrition needs of HIV-positive kids. We know that children with HIV have a different nutritional requirement, and what we found is that by providing the nutritional component, with the government providing the HIV medications, you can better improve the outcome of these kids from an infection standpoint and from a health standpoint.
And we're looking at starting a care center for people who come from out of state to work with the local government and get their medications when they come to Chennai.
Our video project is another one of our programs that takes the ideas of the people we work with and lets them flourish. The students got together and decided that the biggest problem facing them is how do they avoid getting themselves into high-risk situations, and how do you spread that knowledge to other kids. What they found is that we could produce films, which is hugely popular in India, and be able to get the message across. It's a series of short films, anywhere from 1 minute to 2 minutes long, that highlight one particular message within HIV.
So we're really working with many of the aspects of the HIV scourge. We're working to prevent it, we're working to provide nutritional care for people who are affected, and we're looking to provide some sort of medical care with local governments.
The single most important thing about our organization is the fact that we are able to take such little resources and turn it into something that has such a huge effect.
India is cheaper than the US, and donations made in US dollars, can go 4 times as far in India in terms of what's donated.
And that's where the contributions from things like Hope in the Face of AIDS and our small grounds come into power. Every dollar that you give, you can see on the ground. It's not something you see in large organizations, and that's something that we really pride ourselves on having.
The donations that we get in events like the Hope Dinner are the seeds for our programs. They allow us the money to start programs, to work with the individuals, to work with the community, to gather data about how effective that program is and refine it. Grant opportunities really only exist for existing programs. If you don't have any seed money, you don't have any money to start programs which allow you to get grants.
All of the money that allows IAPA to run, from our day-to-day operations to our programs, comes from private donations and not grants.
Donations made to the organization really allows us to do what we need to do. If I want you to take away one thing from this dinner, I want you to know that you can make a positive impact on the people in India.
When you talk to these children, they don't know what an infection is. They don't know what the disease is. They just know that their life is a little bit different than somebody else's. Their childhood is different. They have to be careful about certain things. And that's a burden that is not something that a child should have.
What we're really looking for is to be able to grow in a sustainable way, that we can continue to provide our services while increasing the number of people that we reach.
We've seen the amazing work that can be done with these volunteers and the work that we do, and that just fuels you. That it's one of those things that will allow you to keep going no matter what.
When we started this, like I said, we were 2 college students with an idea, and to see us at this point is just staggering. And we've worked hard, and we're proud of the work that we've done, but we know we wouldn't be a 10th as far as we are without the support of everyone in India and here in the US. It's mind-blowing.
It's a huge recipe for success when you have people who are invested for the right reasons, feeding off of each other. And that's something that you can't create every day in every organization. It's something that's born out of people who really care about what they're doing. The true power of IAPA will always be found in the passion of the people involved.